Everybody out there, thank you for joining me today. I want to talk about cognitive behavioral therapy. And if there's any misconceptions about cognitive behavioral therapy, I just want to make you aware that your thoughts are incredibly important. And think about it in terms of nutrition. What you're feeding yourself certainly makes a difference in how you function. If all I'm doing is eating junk food all day, I am not going to feel as good. And if all I'm doing is feeding myself stuff that causes me worry, fear, and anger, I'm not going to feel very good as well. So paying attention to our thoughts is important. That's the essence of cognitive behavioral therapy. Now, what I've done in this podcast is I have loaded several videos based on my 25 years experience, really even more than that, on cognitive behavioral therapy, and asked it to analyze it. And then AI actually creates the voices that you're going to hear. Now, what I'm going to do is stop at points, me personally, a real person, stop at points to add commentary and then do a summary at the end. So, yes, you're going to be hearing voices talk about this. That's from AI analysis of cognitive behavioral research and videos that I've done. And then I'm going to add some commentary to help clear it up. Let me know your thoughts on this.
Okay, so today we're going to do a deep dive into CBT.
All right.
Cognitive behavioral therapy.
Sounds good.
You know, this is something that I think a lot of people have heard about,
Mhm.
have maybe even, dabbled in, but we're going to really try to get to the core of what it is
Yeah.
and how it can actually be applied
Absolutely.
in everyday life.
To everyday life. Yeah.
Yeah, and so the core idea, the real engine of CBT, is that our thoughts.
Yeah.
They actually, they aren't just floating around aimlessly up there.
Yeah.
They actually have a tangible impact on how we feel
That's right.
and what we do.
Absolutely.
And I think that's something that, we hear a lot, but it's like,
Yeah.
okay, so how do we actually apply that?
Mhm.
And that's where I think CBT becomes really practical.
Right.
And I think for you, the listener who's always looking for
That's
knowledge that's not just interesting, but,
Mm-hmm.
really makes a difference in your day to day.
Right.
I think this exploration of CBT
Yeah.
could
Yeah.
potentially give you some real takeaways.
I think so too.
Yeah.
And the resources you've provided are great.
I'm still kind of blown away by how these AI voices seem pretty natural. There's some glitches in there, but I'm also very impressed with the analysis it does of the key points of the past videos that I have uploaded to be analyzed. So let's keep going here.
Good.
We've got these transcripts from these videos by Russ
Yep.
Curtis,
Yeah.
Ph.D. It's a professor of counseling.
Mm.
And I really like the scope of what he covers.
Yeah.
We've got everything in here from, what's the fundamental difference between CBT and mindfulness?
Right.
All the way to very specific CBT techniques
Yes.
that you can start to understand and even apply.
Yeah.
So really good stuff.
It's a great overview, and that's kind of our mission, I think, in this deep dive is
Yeah.
to really extract those key principles
Yeah.
and get to the heart of what CPT is
Right.
and how it can be relevant,
Yes.
in everyday life.
To your average person. Yeah.
Exactly. And so think of this as your streamlined guide
Right.
to the core of CBT, drawing from this expertise of, Dr. Curtis.
And as we go through this, you'll start to notice a few really core ideas.
Okay.
One of the things that comes up over and over again is this interconnectedness
Mm-hmm.
between our thoughts, our feelings, our behaviors,
Yeah.
and even our physiology.
Mm-hmm.
Our body. He even refers to a map
I love that. Yeah.
with 4 different areas
Yeah.
that are all connected. And we'll get into those a little bit more specifically.
Okay, so let's start exploring that right now a little bit.
All right.
Because another really significant aspect of CBT is the idea that we can actually identify
Right.
and then challenge those thoughts and beliefs that
Yeah.
aren't really serving us well.
That's right.
Those self-limiting beliefs
Absolutely.
that can really act as invisible barriers
Yeah.
in our lives. And so we're going to
Yeah. That's a great way to put it.
look
Yeah.
at that. And we'll also look at how making meaningful changes through CBT,
Mm.
it isn't really about these sudden dramatic
Sure.
shifts, you
Right.
know?
Like flipping a switch.
Right. It's more about consistent practice and taking these smaller,
Yeah.
achievable steps.
Absolutely.
Yeah.
A couple points there that are really need to be taken away. in order to change kind of our maybe core beliefs, faulty thinking, it requires practice. It's not going to be something where we're going to have an aha moment in counseling and then be able to take that away and use that in our everyday lives, our careers, our relationships, and so forth. We've got to continue to practice, much like learning a musical instrument or a language or a sport or math, chemistry, you name it. We've got to practice. It's not enough just to think about it, read about it, or talk about it. So that's a key feature, and I don't see that stressed enough in the CBT textbooks and articles that I read. Practice is key. Albert Ellis would agree. I know this.
So why don't we start
Yeah.
by looking at this distinction that he makes right at the beginning
Okay.
between CBT and mindfulness.
Yeah, this was something I was really
Yeah.
curious about because I've heard these terms used almost interchangeably.
Right. Yeah.
But he uses a really memorable
He does.
image to illustrate this.
Yeah.
The analogy of a tug of war.
That's right.
Oh, I love this.
This is great.
So imagine those negative thoughts, right?
Hmm.
That inner critic
Yeah.
as this rope.
Okay.
Okay. And so, when that negative voice in your head say
Yeah.
it's telling you you're going to fail,
Yeah.
you're just not good enough,
Mhm.
starts pulling on that rope.
Okay.
What approach does CBT suggest we take?
So CBT would say that you need to actively engage
Okay.
with that negative self-talk.
Okay.
It's about questioning it.
Right.
Is it true? Is there evidence for this?
Yeah.
What's the evidence against it?
Mm-hmm.
And then actively working to reframe those thoughts.
Okay.
So, if that thought comes up, I'm going to fail,
Yeah.
maybe you challenge it.
Right.
You say, well, okay, I might be feeling like I'm going to fail right now, but what are some times that I haven't failed? What strengths do I have that I can bring to this?
Yeah.
You're actively pulling back on that rope,
I love that.
trying to, gain some ground.
So you're not just passively accepting it as truth.
No.
You're actively
Right.
pushing back,
Right.
looking for evidence
Yeah.
that contradicts it.
Exactly.
It's this direct
It's this active engagement.
engagement, this mental tug of war.
Yes.
Now, mindfulness, on the other hand,
Yes.
offers a different
Offers a different strategy.
strategy, right?
Yeah.
So if that same thought arises,
Mhm.
you're going to fail. You're
Yeah.
not good enough. The mindful response is to recognize that thought. Okay.
But without getting drawn into it.
Yeah.
It's about noticing it,
Right.
acknowledging its presence as a thought,
As just a thought.
and then letting go of the rope.
Yes.
So instead of fighting the thought,
That's right.
you're just observing it,
right.
like almost watching a leaf float down a stream.
Yeah, that's a great image.
You're not trying to change it
Mm-hmm.
in that moment. You're just aware
You're just aware of it.
of its presence.
That's right.
Yeah. And he makes, I think, a really crucial point here,
Yeah.
which is that, we're all human.
Mm-hmm.
We're all
We're all going to grab that rope again.
going to grab that rope,
Sometimes, yeah.
right? We're going to get caught up
Absolutely.
in believing those negative thoughts.
Yeah.
And both CBT and mindfulness
Mhm.
require this consistent practice.
Yeah, it's a practice.
Right. It's not like a one and done. You do
Right.
it once and you're cured.
Exactly.
Right.
It's about building that mental flexibility.
To be able to engage or let go,
Yes.
depending on what's needed.
So that distinction is really helpful. I
Yeah.
think CBT is more about actively working with the content
Hmm.
of our thoughts to change them.
Okay.
Mindfulness is more about
Right.
changing our relationship
Yeah.
to those thoughts, creating some space.
That's a great way to put it.
Okay, they did a really nice job there, and I just want to echo that CBT is saying, hey, we don't have to just accept that we're small or fearful or bad or flaw, all that kind of stuff that maybe we've been taught since we were a little kid. We can actively engage, do some cognitive restructuring. The mindfulness is more of a metacognitive strategy to where we're saying, hey, wait a minute, there's a thought. I don't have to focus on that. I actually do get the choice of what I'm going to focus on. I don't need to focus on it. So if you want to think about mindfulness as a metacognitive strategy to where we get in our hot air balloon or maybe our drone and we just look down and go, oh, look at those thoughts. There's the thought that I'm not good enough, or there's the thought that, I'm bad in some way, or not smart enough, or rich enough, whatever it might be. And we go, those are just thoughts. What is it I want to do? What I want to move forward with? And that's a key fundamental aspect of acceptance and commitment therapy. You're not going to get rid of the depression and anxiety, but we can still move forward with what our true, deeply held values are.
Okay, so let's say we're in that CBT space
Okay.
of wanting to actively change
Mhm.
our thoughts. How do we actually do that?
Well, this is where cognitive restructuring comes in.
Yeah, cognitive restructuring.
That's right.
What is that?
So, the main idea behind cognitive restructuring
Okay.
is that we want to help people think more rationally
Okay.
and to broaden their perspective
Mm.
beyond those sort of narrow beliefs that
Yeah.
we're talking about.
Right, like the self-limiting beliefs.
Exactly.
Yeah, okay.
And he presents this really simple
Okay.
method for doing this that I love.
Okay.
It's called the T-square.
The T-square. Okay.
Yeah.
So paint me a picture here. How does this work?
All right, so imagine you draw this big T
Okay.
on a piece of paper,
Got it.
and on one side you write down,
Okay.
that irrational thought,
Right.
negative thought,
Mm-hmm.
that's causing you distress.
Okay.
So maybe somebody's facing a setback and they think, I'm a complete failure.
Right. Very common.
Very common thought, right?
Yeah.
And what you do is you then work to develop a more
Okay.
healthy,
Mhm.
more realistic,
Yeah.
more balanced alternative.
Right.
And you write that down
Okay.
on the other side of the T.
Okay.
So instead of, I'm a complete failure,
Mm-hmm.
maybe a more rational thought is, okay, I had a setback.
Yeah. Yeah.
It's disappointing, but it doesn't define me as a person
Right.
or my future success.
Right. It doesn't mean that you're.
Worthless.
Yeah. It
Yeah.
takes away that all or nothing thinking.
I see. So it's about taking that absolute statement,
Yes.
which is often very harsh,
And generalize.
very black and white.
Yeah.
Okay.
And making it more nuanced
Mhm.
and grounded in reality.
Yes.
It acknowledges the current situation
Right.
without making like a sweeping judgment about
Mhm.
the person's overall character
Right.
or potential.
Exactly.
Okay. And he also talks about how just writing it down once
Yeah.
isn't usually enough to create lasting change.
He says you've got to practice this.
Right.
You've got to repeat this over and over.
So it's like learning a language or
Exactly.
playing an instrument.
He uses that analogy.
Yeah.
You don't get fluent in a language
Yeah.
or become a great musician overnight.
Right. You have to
You have to practice.
practice
Yeah.
over and over again.
And he also mentioned using reminder cards
Yeah.
as a tool in this process.
Mhm.
How does that work?
So this is a technique that Judith Beck, who's a
I'm right here.
leading figure in CBT,
Right.
really advocates for.
Yeah.
And it's about creating these reminder cards that have.
You know those rational statements that you came up with?
Yeah.
And you keep them in places where you'll see them,
Right.
maybe by your bedside,
Yeah.
in your wallet,
Okay.
and your desk,
I see.
and you just read them
Hmm.
repeatedly throughout the day.
Okay.
And it's a way to kind of like
Great.
challenge that automatic
Yeah.
negative self-talk
Right.
and start to internalize those more
Yeah.
positive ways of thinking.
Right. So you're basically retraining your brain.
You are.
Yeah. Establishing new
Yes.
mental habits.
Yeah.
Okay. So we're learning to identify
Right.
and challenge these unhelpful thought patterns.
Okay.
Now, what about when anxiety shows up
Okay.
in a very physical way?
Right.
Like during a panic attack.
Mm-hmm.
Dr. Curtis's colleague, Betsy Corey,
Okay.
discusses something called proprioceptive exposure.
Okay.
What is that?
So this is a really cool technique
Mhm.
for addressing anxiety and panic disorders. And the basic idea
Mm-hmm.
is that people who experience panic attacks
Yeah.
are often afraid of the physical sensations,
Okay.
the racing heart,
Mm-hmm.
the feeling of breathlessness,
Right.
the dizziness, the tingling,
There.
all of that.
Right.
And so the fear of those sensations
Mm-hmm.
can actually drive
Okay.
and perpetuate
Oh,
the cycle of panic.
I see.
So proprioceptive exposure
Right.
is about intentionally and gradually
Okay.
facing those very sensations
Mm-hmm.
in a safe and controlled environment
Okay.
to reduce the fear associated with
Because
them.
if CBT is like the thought part of it,
Yes, exactly.
this is like
This is the physical experience.
physical part.
Right.
Okay.
That's a great way to put it.
So it's a bit like confronting your fears head on.
Yes.
But instead of an external trigger,
Right.
you're working with your own
You embody sensation.
body sensations, yeah, in a controlled way.
Yeah.
Okay, and Betsy Corey talks about how important it is to establish
Yes.
this really safe and supportive space
Yes, absolutely.
for this practice.
Yeah.
You know, the individual needs to know
Right.
that if they experience panic
Yeah.
during the exercise,
Right.
that it's a normal reaction.
It's expected.
Right.
Yeah,
And there's not going to be any judgment.
that's right.
Right. And the objectives of these exposure exercises,
Mhm.
they're kind of multi-layered. You know,
Right.
one is to gather evidence
Right.
that these sensations,
Yeah.
while unpleasant,
Yeah.
are not actually dangerous.
Why, they're not going to hurt you.
They're not going to lead to any harm.
Exactly.
Two is to practice
Mm-hmm.
using coping skills
Right.
while actively experiencing these
Right.
sensations.
So in essence, and this is a very good video that I've got on my YouTube channel about proprioceptive and how do we actually work with that, is that what we run from grows bigger and creates more fear. So if we can kind of face it, then the fear will decrease. And for folks that feel intense anxiety and panic, one of the things they can start fearing is when their pulse rate starts to heighten, when their breathing becomes more shallow. So what's happening in this practice is that you're in the safety of a counseling's office and you are increasing your pulse rate. Maybe you're doing jumping jacks while breathing through a straw. And so what you're doing is getting used to the fact that, oh, I can be kind of uncomfortable. This does not mean it's the end of the world. And I've got some control of this. And then like, oh, well, what helps me recover after I try these things? So that's what that's all about. But I highly encourage you to watch the video of proprioceptive dealing with anxiety that I've got on my YouTube channel.
And ultimately, to
Yeah.
build a sense of confidence
Yes.
in one's ability to manage
So-
and tolerate these physical experiences.
About building that tolerance.
Yeah. And she outlined some
Yeah.
very specific exercises.
Yeah.
She did.
That people can do
Mm-hmm.
to intentionally bring on
Aye.
these sensations.
Yes.
You know, things like physical activity
Right.
or manipulating their breathing.
Yeah. So, for example,
Yeah.
to induce that shortness of breath
Mm-hmm.
and rapid heart rate,
Yeah.
she suggests, you know, doing jumping jacks,
Okay.
walking up a flight of stairs quickly,
Right.
or running in place.
Yeah.
And then she also talks about straw breathing.
Okay. Straw breathing.
Yeah, where you breathe
Mhm.
through one or two small straws
Okay.
to simulate that feeling of being smothered
Wow.
or having a restricted airway.
That sounds intense.
It can be.
Yeah.
And then finally, she talks about controlled hyperventilation.
Okay. So like briefly,
Deep, rapid breaths.
that's it.
Okay.
To kind of evoke those feelings of dizziness
Yeah.
and shortness of breath.
Wow. Those sound
They are.
quite intense.
They can be.
It
Yeah.
almost feels counterintuitive
It does.
to like intentionally bring on the very things
Right.
that you're trying to avoid.
Yeah. Why would I want to do that?
Right, exactly.
But the key is that it's planned.
Right.
It's controlled.
Mhm.
You know what to expect,
Yeah.
and you know that it's temporary.
Yeah, and she really emphasizes that.
Yeah.
The second part of this process is vital,
Absolutely.
which is actively using your coping skills
Right.
after the exercise.
Yes.
So this could be, you know, practicing breathing exercises,
Mm,
progressive muscle relaxation,
right.
guided imagery,
Whatever works for the individual.
whatever calming strategies work for you. So you intentionally trigger the sensation
Right.
and then you immediately practice
Yes.
bringing yourself
Bringing yourself back down.
back down.
Yeah.
It's like showing your system,
Yeah.
you know, that you have the ability to
Right.
manage these feelings.
Exactly.
Yeah, and homework
Homework's a big part of this.
is a key component.
Yeah.
She recommends practicing these exercises up to 5 times a day.
Ideally, without distractions.
Wow. Okay.
To let those sensations fully emerge
Okay.
and then practice those coping strategies.
Yeah. So this is
It takes effort.
it takes effort,
Yeah.
but potentially could really make a difference.
Yeah,
Now, you know,
yeah.
to really see how these different components of CBT
Yeah.
can work together in a real life situation.
Right.
Dr. Curtis presented this role play
Who did?
that illustrated
Yeah.
how CBT principles could be applied to a
Mhm.
very specific challenge,
Right.
which was nervous driving.
Nervous driving, all right.
So, can you walk us through
Okay.
how that scenario
Yeah.
demonstrates
Oh,
the
yeah.
core elements of the CBT model in action?
So in the role play, this individual
Uh-huh.
describes having a lot of anxiety,
Okay.
even panic
Right.
while driving.
Yeah.
and they're having these negative thoughts
Mm.
like, I can't handle this,
Right.
I'm going to cause an accident.
Right.
And those thoughts lead to these avoidance behaviors,
Okay.
like stopping in the merging lane
Wow.
out of fear,
Yeah.
and a lot of hyper cautious driving.
Right.
And then physically, they're experiencing
Yeah.
sweaty palms, nausea.
Right. All the physical symptoms
Yeah.
of anxiety.
So this really shows that map
Yeah.
in action.
Right.
Those feelings triggering those negative thoughts,
Right.
which then impact the behavior
Yeah.
and also manifest as physical symptoms.
Right. So it becomes this
And they all feed back into each other.
self-perpetuating cycle.
That's exactly it.
The initial anxiety fuels the negative thoughts, which
Right.
then, impacts the driving behavior,
Yeah.
triggers those uncomfortable physical reactions,
Mhm.
which then can amplify it.
And then makes the anxiety worse.
Yeah, exactly.
Right.
So how does CBT step in
Okay.
to try and break this cycle?
Well, the next step in the role play
Yeah.
is creating a goal map.
A goal map. Okay.
Yeah.
What is that?
So it's about envisioning
Okay.
what you want instead.
Right.
So instead of feeling overwhelmed by anxiety,
Mm-hmm.
the goal is to feel calm,
Right.
relaxed,
Mhm.
confident
Yeah.
while driving.
Okay.
And the thoughts would shift
Yeah.
to more positive self statements.
Okay.
I am a capable driver.
Okay.
And the behaviors would be
Yeah.
less avoidant,
Right.
less hyper cautious.
Mhm.
And then physiologically, the goal would be to reduce those
Sure.
symptoms.
Yeah. I really like that
Yeah.
concept of a goal map.
It's a good visual.
It really provides a clear
Yeah.
direction
Right.
by visualizing where.
The goal map they're speaking about, and I do have videos on this as well, is asking clients to see the interconnection and between emotions, thoughts about self, then how that affects behavior, and then how that affects physiology. This is how Meichenbaum does counseling, or at least more recently, I should say several years ago, I saw him demonstrate this. Oh my gosh, maybe 20 years ago. But anyway, is that clients usually come in expressing their emotions, so we get a feel for that. It's helpful to ask them, when you're feeling this anxiety, what kind of thoughts do you have about yourself? And then when you process that using good person-centered skills, we can ask about how does that affect your behavior, and then how does that affect your physiology. So that's the goal map that they're talking about.
Want to be.
Absolutely.
So what are some of the concrete steps,
Okay.
that were discussed
Right.
to help the nervous driver
Yeah.
begin to move towards that goal?
So initially, it's about addressing
Okay.
the negative thinking
Right.
and then the physiological anxiety.
All right.
So they talk about positive visualization,
Okay.
imagining successful driving,
Yeah.
merging confidently,
Mhm.
navigating different road conditions,
All right.
and then also relaxation techniques
Okay.
like deep breathing,
Yeah.
maybe using prayer or mindfulness
Right.
to center yourself
Right.
before you even get in the car.
Yeah.
So starting to make these small changes
Right.
in your thoughts and your body.
And this is not about expecting an immediate transformation from,
Right. Not a quick fix.
extreme anxiety to perfect calm.
No, it's a process.
But it's about taking
Yeah.
these small incremental steps
Right.
consistently,
That is right.
regularly engaging in the visualization,
Yeah.
practicing a relaxation exercise before you get behind the wheel.
Maybe even while you're driving,
Yeah. Now, Dr. Curtis also talked about,
Yes.
how there are actually different schools of thought within CBT?
That's right.
Mm.
REBT.
Yeah, rational emotive behavior therapy.
Right. By Albert Ellis.
Albert Ellis.
And then Beck's cognitive therapy.
Aaron Beck. Yep.
What are some of the key
Right.
distinguishing features of these approaches?
All right. So RBBT
Okay.
uses this model called the ABCDEF model.
The ABCDEF model.
Yeah. Right. So A is the activating event.
Okay.
So maybe you get some negative feedback at work.
Okay.
C is the consequence.
Okay.
So you feel demotivated
Right.
and upset.
Mm-hmm.
And Ellis's point was
Okay.
that A doesn't directly cause C.
Right.
It's actually B.
Okay.
The belief
Yeah.
about the activating event.
Got it.
That causes the emotional response.
Right.
So the work in REBT is really about D,
Okay.
disputing
Right.
those irrational beliefs,
Challenging them.
challenging them
Yeah.
to achieve a new effect, E,
Okay.
and a new feeling, F.
I see.
So, for example,
Yeah.
if you believe that negative feedback means you're incompetent,
He would really challenge that.
okay,
Is there any evidence
right,
that one piece of feedback
yeah,
defines your entire competence?
mm-hmm.
He might even use humor
Yeah.
to kind of point out
Right.
the irrationality
Yeah.
of those beliefs.
So it's very direct.
Very direct,
Yeah.
confrontational,
Okay.
but also potentially effective.
And so the core idea here is that
Yeah.
it's our interpretation of events,
Yes.
not the events themselves that are
Right.
causing
Yeah.
our emotional reactions.
Exactly.
That's a key feature of RABT. And I think, you know, if you watch video of Albert Ellis, he could be a little bit confrontive. I think you're going to calcify the approach. You're going to bring your own voice, your own style. I don't think we necessarily need to be confrontive. However, in some ways, having somebody who's using humor, maybe getting a little bit loud if it's appropriate, could wind up being, hey, I'm going to be the voice that's saying, I allow you to dispute thoughts that say you are small or ineffective or flawed in some way. So, in that regard, I think Ellis may have been onto something. But of course, your job with all theories is to develop your own voice, your own counseling style. And we need to learn about all theories. Because it's not a one size fits all. Clients are going to need different things. We need to be very well versed in many different ones. And cognitive behavioral is very much an evidence based theory. But it's not about telling clients that their thought is irrational unless the client volunteers that. They could be talking to you saying, hey, I recognize this is irrational. Then we might want to use that language. But I'm not. I'm going to look more at limited versus expansive thought, unhelpful thought versus helpful thought. This is the kind of language I use in when working with folks.
Okay, what about Beck's cognitive therapy?
So Bick's model
Yeah.
is all about identifying these underlying core beliefs.
Core beliefs. Okay.
So these are these kind of deep-seated,
right.
often unconscious assumptions we have
Yeah.
about ourselves, the world, other people.
Okay.
And those give rise to what he calls intermediate beliefs,
Okay.
which include attitude, rules, assumptions,
Mm-hmm.
and then those shape our automatic thoughts. The quick thoughts that just pop up,
Right.
and then it's those thoughts
Yeah.
that trigger our reactions.
Got it.
You know, emotional, behavioral, physiological.
So in therapy, a key technique in Beck's model
Mm-hmm.
is Socratic questioning.
Socratic questioning, yeah.
What is that?
So it's about asking guided questions
Okay.
to help the individual examine
Right.
the evidence for their thoughts
Okay.
and their underlying beliefs.
Okay, so for example.
Yeah. So let's say somebody has this core belief,
Okay.
I am unlovable.
Okay.
And maybe they have a disagreement with a friend,
Mm-hmm.
and the automatic thought is,
Right.
no one will ever truly care about me.
Right.
Therapists might ask, what evidence do you have that no one ever cares about you?
Right.
Can you think of times when people have shown you care?
Right.
So another feature that the Socratic questioning, which is really more Beck. Now Judith Beck, I've seen her practice in live sessions, and she does very methodical, helping people see a thought that may be unhelpful, how often they experience this, how they might restructure it. The Socratic questioning of what evidence do you have that you are never going to be successful or never have a good relationship. I had plenty of clients who could present a lot of evidence. But you know what? That used to scare me from this a little bit. I actually still think the question is very helpful because once they leave session, I bet that question is going to stay there. And I want that question to be like throwing a wrench in this cog of negativity for them. I want the next time they're ruminating about whatever it is that they don't feel good about themselves, for that question to pop up and maybe slow the cog a little bit. So just know that Beck and Ellis had different kind of ways of doing things there, but I think they were both very helpful. Again, coming back to the theme of let's examine what we're feeding ourselves with our thoughts and how that affects us. The other school, I would say there's kind of three primary schools of cognitive behavioral: Ellis, Beck, and Meichenbaum. Well, we talked prior about Meichenbaum with kind of that emotional map. So they were all three doing very similar things and ultimately to help people think more expansively about themselves. So I hope this was helpful. Let me know your questions and we'll talk to you in the next video. Take good care.